5,000 children under the age of 5 die every day in India, 20% of the world's total. To address this critical issue, the American India Foundation developed a seminal public-private partnership with Tata Steel, Dr. Abhay Bang from Search, the local community, and local government. Through MANSI, AIF has empowered local women to become leaders in changing minds about accepting antenatal care, institutional deliveries, and early newborn care.
Welcome everyone, and thank you for joining. My name is Tasneem Chipti. I was born in Mumbai and raised in Boston, and together with my husband Alex Franz, I've been a longtime supporter of AIF's SMART programs focused on women and girls. Today's program examines health issues facing pregnant women during COVID-19. COVID-19 is a global catastrophe. It has affected each one of us, but it has wrought exceptional human misery to certain segments of society. Today's program addresses an aspect of this suffering in two different ways. The first part discusses the issues from the perspective of science, and the second from the perspective of art, with a portrayal of human suffering followed by hope. And we hope you will stay tuned to the end. One of the many lessons from this pandemic is that we all have a part to play to address basic human needs. The we includes governments, NGOs, professional communities, families, individuals. We all have to step up to do our part. Please find a way to play a part and think about supporting AIF. Now I give you Dr. Sunita Pereira. Dr. Pereira is Associate Professor Emeritus of Pediatrics and former staff neonatologist at Tufts Medical Center in Boston. She's also the chair of the campaign committee of AIF's award-winning Maternal and Newborn Survival Initiative, the MANSI program.
Virtual chat on this beautiful sunny Saturday morning in New England. Today we highlight the challenges faced by pregnant women and their newborns in rural and urban India during the COVID-19 pandemic, and showcase how AIF's MANSI program is dealing with these challenges. Our panelists, chosen for their expertise in maternal and neonatal health, are Padma Bhushan Dr. Neelam Kler, Chairperson Department of Neonatology at Sir Gangaram Hospital, and Dr. Amit Chatterjee, retired Commander, Indian Navy, Director of Public Health at AIF, and head of the Maternal Neonatal Survival Initiative, MANSI program. MANSI is one of AIF's signature programs, which started as a public-private partnership pilot, and its tremendous impact on reducing maternal and neonatal mortality in the tribal areas of Jharkhand led to its expanded implementation in Jharkhand, Uttarakhand, Odisha, and Andhra Pradesh tribal regions, where healthcare accessibility is poor, and this program is serving approximately 2.2 million poor and vulnerable tribals with excellent results. However, COVID-19 disrupted life as it was and created many challenges. Dr. Chatterjee, can you address new and unique challenges that rural women of reproductive age are facing during this pandemic?
Thank you, Dr. Pereira. Good morning to all of you in the US and good evening to us at home in India. As most of you are aware, the core of the MANSI program is the empowerment of the frontline workers, or the ASHA workers, or the Sahyas as they are called in Jharkhand. ASHAs are the backbone of provision of basic healthcare services, especially to the pregnant women and to the newborn in the rural areas that we implement MANSI. I would like to put the challenges, as you said, into three buckets. The first is challenges to the healthcare system per se, because of the disruption of services as a result of COVID-19. The most important of this is the amount of the backlog that has been caused because of the antenatal services, the postnatal services, and the immunization. The There's a shortage of human resources because doctors, nurses, ANMs, they have a problem to come to the healthcare institutions because of the lack of transportation. There's a disruption in the supply chain which causes shortage of medicines, shortage of consumables, vaccines, and so on. The second bucket I would say is challenges to the ASHA itself. The ASHA also is a lady, and she is very scared. She might have small children at home. She is very scared of getting COVID herself during her interactions with the community. And we have to work on allaying her anxiety and fear. And also because of the COVID-19, there's an excessive workload on her because she's been told by the government, her government authorities, to actually, at the moment, conduct, the fever surveys and, COVID tracking and reporting and so on. So health services itself, especially maternal and child health, has taken a backseat, and we are facing a huge challenge because of that. And the third important bucket is challenges to the pregnant woman herself. I mean, because of the lack of antenatals, the shortage of IFA tablets and tetanus vaccines, as I said before, I mean, her antenatal checkups are missed. High-risk pregnancies do not get detected, and cases of preeclampsia, gestational diabetes. Another very important thing that we have seen is because of the lack of good diet. There's a shortage of vegetables, fresh vegetables and fruits. I mean, these might sound very sort of basic, but they're an issue for us. And also she's very scared to go to the hospital for her delivery. She's scared herself and her little one may get infected.
Yeah, so lack of prenatal visits will impact early detection of problems in pregnancy, such as congenital anomalies, risk of hypertension, diabetes, malnutrition, iron deficiency, lack of immunizations, placing mothers at risk for morbidity and mortality. But furthermore, risking the newborns, risk of prematurity, small dates, neonatal tetanus, neonatal sepsis. These are huge challenges. And this is a very big problem. Dr. Kler, during any crisis, healthcare infrastructure of maternal and child health takes a backseat. And this crisis is no exception. US data suggests that pregnant women are overrepresented in hospital admissions and also in ICU admissions compared to non-pregnant women. How is the situation in India? Pregnant women are concerned about their pregnancies and deliveries due to the pandemic. Can you address these concerns with respect to the urban woman in India?
First of all, thank you very much, Sunita, for having me on this panel on a topic which is very hot right now, being pregnant in COVID pandemic. And as Amit has already emphasized that, whether you're infected with the virus or not, in this era, because of lack of preparedness and the focus being on the COVID patients, the infrastructure, the human resource, everything is being focused on that. So in a scenario where we were already lacking on these areas, definitely we are endangering a large number of pregnant women and their newborn babies. And as you know that, though the government of India has given a very clear mandate that outreach programs like immunization and maternity services should run in the full focus, in the full force. But we know that the ground reality is that, at the state levels, the outreach programs are being affected because of the scare of infection, because the services are being now focused more. As Amit very rightly said, that even ASHAs are taking care of the fever patients instead of the pregnant women. And if we look at the policies and the services, whether they are urban or rural, or they are large tertiary care hospitals, or they are smaller hospitals, since we are taking care of both COVID and non-COVID patients, and when it comes really to a pregnant woman, she is scared of, if she is not COVID positive, getting infected or having cross-infection if she comes to a large tertiary care hospital. So on one side, they are scared of being to the hospital. And on the other side, if you look at the iniquities of our infrastructure, if you look at the urban, little educated or rich women or affluent women, they are concerned about not having their regular clinic times. They are scared of going to the hospital because of the cross infection. Whereas rural women or poorer section women, they have a lack of access, and they also have a risk of infection, and probably that's what is endangering them.
Now tell me, how are you dealing with this at Sir Gangaram Hospital as far as the neonatology unit is concerned, with the COVID pandemic?
As you know that, most of the tertiary care large hospitals are also taking care of some proportionate of COVID positive patients. So that means that, the pregnant women who come, whether they are COVID positive or COVID negative, we have to have separate infrastructure for them. And as you know that, large hospitals with the increased number of patients, creating a new infrastructure, creating a new ICU where you're going to take care of patients who are COVID positive is a large constraint on the hospital. And also at the same time, you have to provide PPEs, larger number of PPEs. There's shortage of PPEs, shortage of human personnel. And at the same time, the hospital staff is constrained. So there are huge issues, but we are dealing, we are taking care of things like telemedicine. Many of the, consultations are virtual. We are running clinics in spite of, increased constraints. So we are dealing with it, but definitely there is huge load.
Dr. Chatterjee, how are the ASHAs dealing with these challenges? And could you highlight AIF's role in this pandemic? AIF has been at the forefront of, taking care of the migrants, but could you highlight what we are doing for the MANSI program?
As I said before, contribution of the ASHAs are critical to provision of care to pregnant women and newborn children. Now, the first thing we are trying to do is to provide an enabling environment for the ASHA. Counseling them. Our community mobilizers who are working on the field have developed a rapport with them, a very, very fine rapport with them over the last 4 or 5 years that we've been working. We know every ASHA by name. We have her numbers. We talk to them. We counsel them. And the first thing we did was, as soon as the pandemic started, was to counsel them and to try to allay their anxiety. Also, it's our endeavor to, provide them protective gear such as masks, gloves, face shields, soaps, so that they can protect themselves and get them up to speed with what they are supposed to do, the do's and don'ts of COVID. First thing is their safety. That was our primary objective. And also, we are trying to ease their workload by trying to establish a mobile platform, a technology platform. This will, help them to assess high-risk cases. There'll be SMS reminders. There'll be electronic protocols. A voice messaging system, interactive. They can actually record their message, and somebody can reply to their queries and so on. So we are trying our best to sort of get them back into the their routine things, and so that our maternal and child health is not compromised on.
You said that ASHAs have been the corona warriors on the front line of rural India, safeguarding the health of their respective communities. And
Absolutely.
AIF's super trainers have had a great role in, maintaining the maternal child health services, because the ASHAs are so preoccupied with taking care of their communities as far as COVID is concerned. Could you tell us a little more about that?
See, as I said before, the first thing we tried to do was allay the anxiety. And with this mobile platform that we've been trying to establish, and we are going to establish in the next month or so. I mean, what we plan to do is, we plan to have refresher trainings sort of cluster in close groups of mobile, training them with mobiles where the lockdown is still existing, and our community mobilizers cannot go and actually train them like they do. The most important thing we are trying to address is, the ASHAs also is stigma and discrimination. When they go down to the community, there's stigma and isolation of these COVID positive pregnant women and children is one huge issue. So we're trying to, address that and counsel both the mother and the ASHA, so to speak. Now, this technology platform can disseminate we can disseminate content regarding COVID and also how it affects, what are the precautions the pregnant women should take. New content can be sort of uploaded regularly by the ASHA worker. The ASHA can record her queries if she has any about COVID when she's dealing with the pregnant women or the newborn children, and seek a feedback on the issues that she has to address. It's basically a two-way management system. Also, she can conduct surveys and, as I said before, do an assessment of, high-risk cases, and so catch cases of preeclampsia, gestational diabetes at an early stage. Sunita.
Can you talk about the four E's that you have as a slogan: educate, enable, educate, engage, and enhance?
I'll be repeating myself. As I said, first thing we'd want to do is creating an enabling environment for the ASHA, allay her anxiety, give her protective gear, said that don't worry, do your job. I mean, and do what you're supposed to do. That is address, maternal and child health, pregnant women and newborn children. Educate the ASHA, as we said, we're trying to establish this mobile platform. If I forgot to say this, but the places where we work in, the Android phones are just with about 5 to 10% of the ASHAs. So I mean, we can talk about apps and digital technology and so on and so forth, but we have to do something which is doable, and that we have to manage with their, the normal mobile phones, Nokia, the old Nokia mobile phones, if you remember. So, I mean, we are trying our best to sort of work with them so that, maternal and child health is not compromised, as I said before.
Dr. Kler, you stated recently, change hospital policies due to concerns about cross-infection due to SARS-CoV virus, changes in doctors' office hours, and to an extent, loss of human touch have all affected and may cause stress and emotional conflict in pregnant women. Can you elaborate?
Yeah. I would take them one by one. The change hospital policies and risk of infection. As I already told that, every hospital is taking some proportion of COVID positive patients. And that is one scare in the mind of pregnant women, that is the cross infection. Secondly, women are, because of the isolation policies, because of the quarantine, they're kind of secluded. They are left alone. And because of poor access, their family cannot visit or their partner cannot be with them. And even the health workers, imagine, seeing the sympathetic face of the nurse or the doctor, but there you have a doctor or a nurse standing in a PPE. It is a little, scary for the women, and the atmosphere, the whole atmosphere looks more gloomy, not that happy. At the same time, the doctors, the nurses, they are all overworked. They are overstretched. They're taking care of positive, negative patients. A, B, many of the doctors have been, taken, or the nurses, residents have been taken. They may have to wait for a little longer time before a doctor comes and tells them that the baby is fine. Then they're scared of breastfeeding their baby. So both the antenatal care, the natal care, the postnatal care is fraught with a kind of a fear, and also that, whether I'll catch the infection during pregnancy, whether I'll transmit the virus to my newborn baby, and how safe it is for me to breastfeed the baby. So all this, is creating, and there will be some economic crisis also, because of changed working, because of changes in the transportation. So I think as it is, pregnancy, though, is a moment of happiness, something, which the whole family celebrates. But in this era, there is a kind of a fear which is lurking in the atmosphere, and the risk and the chances of pregnant women having conflict, mental conflict, is much higher.
Yeah.
We have to deal with it. We have to support them in spite of the fact that we are overstretched.
Yeah, and as we and neonatologists understand the importance of breastfeeding in newborn and infant period, how it impacts a person's long-term health, developing a healthy gut biome, improved neurobehavioral outcomes, protecting the baby from infections, allergies, insulin-dependent diabetes, and all these things. These have all been affected by COVID-19. And even the separation of baby from the mother can be, can increase the risk of maternal depression. And we know what the effects of maternal depression are on the baby as far as bonding is concerned. So anxiety, separation, all these are huge, huge issues. And, this is true for urban women, it's true for rural women. And, it's a huge, huge issue. Now, Dr. Chatterjee, institutional deliveries decrease maternal and neonatal mortality. And this is how, you have been able to encourage tribal women to accept antenatal care and institution deliveries. The ASHA workers accompanied these mothers to, primary healthcare centers so that they would deliver. And I know in Jharkhand, the institution deliveries were very, very few, and increased maternal deaths due to obstructed labor or hemorrhage were a huge issue. And this was all taken care of because of excellent work done by the AIF's MANSI program. Now, how is it then in the COVID era? How is AIF doing its work given the constraints that we are discussing?
That's an excellent question, Dr. Pereira. Actually, as you said, before we started working in Jharkhand, the number of percentages of pregnant women going for institutional deliveries was very, very low. And we managed to overturn it to almost around 85 to 90% right now. This was before in March. But however, after the COVID, the COVID crisis, what has happened is, we are seeing that pregnant women are very, very hesitant to go to the hospital for obvious reasons, as we have said before. So we have to deal with this, and we have to sort of convince them. We are working at it, both our community mobilizers, the team of MANSI in the field, along with the ASHAs. We are convincing them to actually, institutional deliveries. We encourage institutional deliveries for reasons known to all of us. However, if the woman decides that she's absolutely adamant and her family is absolutely adamant that they do not want to go to the hospital, then we try to ensure that the A&M is present, or some skilled birth attendant, as we say, SBA is available to conduct the delivery. And we ensure that the ASHA immediately tries to arrange for the 0-dose immunization, which is extremely important. As regards immunization, what we are trying to do is we are trying to facilitate. We have something called the Village Health and Nutrition Days in the rural areas, where all the pregnant women get their children, the newborns and the young children, and immunization is done. How we are trying to do ANCs. ANCs also is a huge issue which we are having. As I said before, there was a complete disruption of the ANCs, and therefore a lot of ANCs of pregnant women have been missed out. So we try to do, we are trying to do it with a staggered approach. We give the pregnant woman a certain time to come and facilitate the A&M to be there, or if she is near a PHC, that the doctor is he has a list of the pregnant women with which we are coming and the various time slots. And also immunization is done by the various outreach services. We try to, our community mobilizers are trying to facilitate that, help out the existing public health services to facilitate outreach services and catch up rounds for immunization. Sunita.
Great. Researchers at Bloomberg School of Public Health estimate that if disruption to programs like MANSI continue for 12 months due to the pandemic, almost 30,000 maternal lives and maybe as high as 500,000 newborn lives will be affected, or rather there will be 30,000 maternal deaths and 500,000 neonatal deaths above the baseline in India. And the impact of this will be felt for years to come. This is going to negate almost 10 years of progress that we have made. And, you know, it is a very, very, very important issue that we as physicians and public health experts need to focus on. And Neelam, as a neonatal expert, what changes do you think we need to implement or discuss that will help us better prepare for future pandemics? This time we were completely blindsided.
I think that's an excellent question, Sunita, and probably this is the time we have to start thinking that, you know, where are the cracks? I think the government spends very little on the healthcare, and a minuscule comes for the maternal and newborn health. So this is the time that we have to think, not only India as a nation, but probably globally we have to think that we have to invest more into health and health infrastructure. More so for a country like India, which spends really 1 to 2% of the GDP, which is nothing. Our public health infrastructure is very, very shaky, very poor. And even the private health sector, you know, the government has to have some quality checks, some periodic audits. You know, even if the government wants that there should be a cap on the management or on the treatment, they should provide some clear-cut guidelines, and they should have audits about what is the quality of healthcare which is being imparted. And there should be some bit of regionalization, you know, like, you know, there should be a tier system that, you know, from a primary health care, the baby goes or the mother goes to a tertiary care, so that, you know, it's not that it's left to just the imagination. I think unless until we take this opportunity as an opportunity to get prepared for the next pandemic, probably the learning is not going to be of any very clear-cut consequences. So if we need a better future and we need a better preparedness for the next pandemic, we have to start thinking and probably learn from now that if we do not have a very sound healthcare system, the economy of country depends a lot on that. So for a better future, we have to invest better into health and health infrastructure. And not only just look at the health infrastructure, but also look at the quality of healthcare which we are imparting. And this is most important when we talk about maternal and newborn health. Whether we are looking at the care which Asha is imparting, which like Amit was so beautifully elaborating, or a nurse at a primary or a secondary healthcare center, or it is anywhere in the country.
Excellent. Neelam, that was really great, insightful thinking, because, you know, we really do need to learn from our past so that we don't commit the same mess in the future. And, you know, we at AIF, or rather Amit and his team at AIF, have done a superb job with MANSI. And, you know, it is an award-winning program. However, significant the impact is a small area where AIF has its footprint. We need to know if there are other such organizations that are also doing the same work that AIF is doing, and how can we help the MANSI program expand further?
Yeah, fortunately, you know, we have excellent work being done by a lot of NGOs which are working on the maternal and newborn health, like MANSI. there are many more, and probably, we can create a larger platform so as to look at the number of maternal and newborn NGOs who have different models. I mean, there are some which have a voluntary health worker from the village itself, which is something like Asha or Sakhi or Saheli or something, or it's a nurse-based module. I know of one or two NGOs which have a nurse-based modules, and these nurses are something like nurse practitioners who work in a health picket in a village, and they are primarily responsible for the training of the health volunteers, which are the village women or the village girls. And they also work in close coordination with the local public health sector, also the PHC or the district hospital. So I think the most important thing is that the NGOs, the bilaterals, the private sector, the public sector, they have to all work in a partnership. And maybe the government can play an anchor and make sure that, the work is united and it is focused well.
Amit, do you have an idea as to what kind of funds would be required to expand to other villages? I know that you are hoping that the government will take over the good work that you are doing, but is there a dollar amount, or is there a dollar amount per mother-infant diet that is required for expansion of this program? Do you have any concrete numbers?
Yes, we had worked out, some numbers for the management of pregnant women or newborn children, and how we can save them. But these numbers vary because of the terrain and the sort of the care. There are other NGOs also working, as Dr. Cler very nicely brought out. There are so many NGOs who are working. So to give a holistic program, if we have to actually fill the gaps, which are the gaps to be working on? I mean, there's a planning to be sort of thought through. There might be some of the NGOs, like say CARE works with Anganwadi workers, and malnutrition is also a huge problem in Bihar. There are various NGOs like Engender Health who work in Maharashtra and Karnataka. Seva Mandir, what Dr. Cler was talking about is the Seva Mandir model in Rajasthan, which it's a nurse model. Now we have to
health services also.
Yeah.
Yeah. So there are a lot of programs, I think.
Sorry. So what we have to do is we have to plan the strategy and what we need to plug the gaps, and then work out a model. We plan to expand the Uttarakhand, what we were doing in 2 blocks of Uttarakhand, covering roughly about 5 lakh population. We plan to take it up to 20 lakhs, and we are asking. We are requesting. We put up a proposal for about 20 lakhs for about. I would say, roughly it comes to approximately. About 500 odd rupees per pregnant woman for 5 years. So
Excellent.
That's what we are saying. I offhand I can't say the dollar amount.
No problem. We are running out of time. There's so much to talk about. We have covered a fair amount of topics, but I have to have some time for questions and answers. So thank you, and I'm going to go to the question and answer session. The first question comes from Ram Kumar. What is the role of public health institutions in maternal and child health during emergencies like COVID-19? And a segue from Prashant Anand, who states that this may be a unique opportunity to seek solutions for tribal communities for whom maternal and child healthcare accessibility and affordability is an issue.
I'll take this question on. As regards public health institutions, health is a state subject in India, and therefore every sort of state has its own health policies, and also they have their own the government policies, and which are dependent on some public institutions, which health institutions, which are in their place. So we have to actually, we do interact with these public health institutions in the state and try to work out a program that will actually suit that. So it's not that one brush paints it all. However, we try to follow the government of India's policies. They have some certain guidelines and policies regarding like, for example, home-based neonatal care or home-based maternal care, how many visits the ashas are supposed to go for. The young child, the home-based young child program has just come up. So I mean, it's like a mix and match between the two.
Okay. Well, there's a question from Nirmala Garimala. What happens if children have no access to vaccination during this period? Dr. Kler?
There's a clear-cut mandate that, the vaccination programs have to go on as usual. But as I already mentioned, that practically, there has been both the things. One is that the outreach programs have not been running to their full maximum. And second has been that because the staff has been taken off to to take care of the COVID patients or to track the fever patients. And second has been that people are also scared of going to the hospitals or to a health center because of the fear. So both these things, I think, has led to problems with the immunization program.
Amit?
That's a question we have to deal with, and that's why we are working at the ground level. When we work at the ground level, we have to actually do a behavioral change, and we have to tell them that, look, immunizing your child is more important and is extremely important, and you cannot miss out on it, especially the zero dose immunization, in which is missed out because of the home deliveries. So I mean, and we have arranged these outbreak sessions, the catch-up sessions, so that immunization is not compromised on. And we are continuously talking to the government. I mean, we've developed this rapport, so we can talk to the government. The government does take our advice and does include us in their task force meetings. So we're definitely bringing out this issue and flagging it off. And I don't see, I mean, this immunization thing is not going to last very long. The disruption, I mean to say, and I think it's slowly coming back on track.
Great.
Yeah, I agree with that.
Great. The next question comes from Krishna Amirthalingam, and I will paraphrase it. What is the easiest way to run a rented NGO-run hospital with support of AIF, if possible?
Sorry, who's that question addressed to? I couldn't get your question, Sunita, ma'am.
What is the easiest way to run a rented NGO-run hospital with support of AIF, if possible?
We've not thought about that, because we want a sustainable system in place. Number one, that's why we are working with the government. An NGO-run hospital is I mean, we do not want to set up a parallel setup in any case, in any place also, and in any case also. I mean, we want to strengthen the government system so that, from a sustainability point of view, AIF is not always going to be there, and we will not always be in a certain area. So setting up a hospital, we've not thought about it. I won't say it's a bad idea, but we've not even thought about it. We've not gone there.
See, the NGOs mostly work at strengthening the primary health care. So they are mainly working at the outreach programs. So the outreach programs are basically taking care of the antenatal care, taking care of the postnatal care, immunization programs, and then, screening some of the primary health problems. Setting up a hospital is a huge task. And probably, even addressing the first question, I think the most important thing, because ultimately, a lot of poor people end up going to the private health sector. So something which is very important is the health insurance, and the health insurance should be provided by the employer.
Great.
Till we have a sound public health system, I think we need health insurance as a kind of, saving for people who have to access secondary health care or tertiary health care.
Yeah. Anupam Sarkar asks why pregnant women are considered at high risk during COVID-19 pandemic from a clinical perspective.
See, if we look at whatever little evidence we have from this epidemic, we know that, you know, the pregnant women are not at increase, has not been seen to be at increased risk as compared to the healthy women. But, you know, in a pregnancy, you are not only looking at, but I mean, whatever the experience is from the previous infections, it is known that infections can play havoc during pregnancy. Another important issue is that, you know, in pregnancy, if a woman gets infected, you know, you're always worried about the transmission of the virus to the newborn also, or to the fetus also. So far, whatever we know that, you know, the virus is not probably transmitted to the fetus, but I think that we still know very little about the COVID infection and its effect on the pregnancy, fetus, and the newborn.
Yeah, today, so far, vertical transmission from the mother to the fetus has not been reported. But today's New York Times reports about 3 kids who tested positive for COVID-19 while their mother tested negative. So there can be nosocomial transmission, you know, from the doctors, from the nurses, or other people around babies. So, you know, a premature baby is definitely more at risk for infections because of a impaired immune system. And, you know, so we are still learning about this virus. Today's report suggests that this virus, just like HIV, does affect the immune system in a negative way and does paralyze the immune system. So, you know, even the health care workers and physicians and public health physicians don't have all the answers. And, you know, this is something, it's a moving target. So we'll just have to stay tuned. There's so many questions that are coming up. However, I don't think we are able to address them all in this call because of the constraints of time. We really appreciate your participation, the attendees, and we will respond to your questions offline by email. And I now want to thank Neelam and Amit for this wonderful discussion and your precious time, as it's rather late in India. The time difference is almost 11 hours, so 10.5 hours. So thank you so much. This was so amazing to have you both on this Zoom call. And please stay on. Now, friends, enjoy the next segment. It's a unique and artistic presentation brought to you by renowned artists in the New England region. Reflect, renew, rejuvenate. Over to you, Jayashree.
Namaskaram. My name is Jayashree Bala Rajamani, and I am a Bharatanatyam dancer in the New England area. I have the honor of welcoming you to this very special artistic presentation that has been made especially for the AIF under this current COVID-19 world pandemic. Reflect, Renew, Rejuvenate is a combination of spoken word, music, and dance, all tied together through the magic of filmmaking. I sincerely hope that you enjoy our presentation. I commence with a poem that I wrote that has been inspired by all the suffering that has been faced by many, many across the globe during this crisis. I ache. From my head to my toes, I ache. With every step that I take on this hot earth, I ache. The sun's harsh rays burns my skin, parches my throat, sickens my gut, and I ache. The sky is clear. The seas are blue. The grass is green. The birds sing sweetly. The air is pure. but I ache. My home is a distant mirage. Pain, my constant companion. Hunger growls in my belly. My lungs can't breathe. My eyes can't see. My brain is in a fog. And I ache. Will it end? Will my home come soon? Will my mother comfort me? Will my children laugh and play again? Will this misery end? Will this ache in my heart go away? For health, for freedom, for love, for hope, I ache.
reflect, renew, rejuvenate. Through artistic exploration and revelation, we aspire to awaken the consciousness, to reflect on the devastating consequences of the COVID-19 pandemic on the lives of millions of migrant laborers in India. We aspire to give voice to the voiceless and infuse hope. Hope to inspire purpose and build trust through renewing our commitment to lend a helping hand to those in need of rejuvenation of their lives. As the Dalai Lama said, it is under the greatest adversity that there is the greatest opportunity for doing good for oneself and for others. I am Meena Subramaniam, a Bharatanatyam artist, teacher, and choreographer in the Greater Boston area, who is deeply committed to the mission of the American India Foundation to rebuild lives of migrant laborers in India that have been affected by the COVID-19 pandemic. I sincerely hope that you enjoyed the artistic presentation that was thoughtfully crafted by a team of talented local artists in the Boston area. I want to take this opportunity to acknowledge and thank my fellow artists, Aparna Balaji, founder of Abhyas, Jayashree Bala Rajamani, founder and director of Bharatakalai School of Dance, Mesma Belsare, artist and co-founder of Samvad, Molly Pal, artistic director and founder of Upasana Odyssey Inc., and Suchita Rao, founder of Rasa. Reflect, renew, rejuvenate.
Hello, everyone. After that magnificent performance, we are rejuvenated. And the panel discussion gave us much to reflect upon, to renew our enthusiasm to get involved. Renew, reflect, rejuvenate. That was all of that. Thank you to Sunita Pereira, my co-trustee, for moderating the discussion between Dr. Kler and Dr. Chatterjee. That was very invigorating. Thank you. To Tasneem Chipti, one of our Gala co-chairs this year. Thank you for that lovely introduction. To the two visionaries or masters of artistry, Jayashree Bala Rajamani and Meena Subramaniam, who is our other Gala co-chair. Thank you. Your vision and mastery certainly hit the mark. To Nirmala Garimella and Suchitra Krishna, who are the office of AIF here in New England, thank you for your relentless hard work. You make sure that everything runs smoothly, efficiently, and effectively. Thank you. And to Nabil Kapasi, our video production person, thank you so much. You can see what a master he is of his craft. Without all of your hard work, this could have never come to fruition. You'd think that a virtual event was very easy to put together, but it takes a lot of hard work and effort by many people. So thank you to each and every one of you involved with this for making it happen. I also want to thank several of the local organizations that have stepped up with their support and their effort to promote the event. Thank you so much. We really appreciate it. And now to our artists, what can I say? Suchita, Aparna, Molly, and Mesma, you are masters of what you're doing. Evocative, emotional, and mesmerizing. I just had to do that. Thank you for putting this very unique piece of art for us, just for AIF and for this event. We really appreciate it. I'm sure every single person that's viewed this is touched and moved. Now on to a little bit about AIF. As you heard from the discussion, AIF's commitment to MANSI certainly has reduced the infant mortality and maternal mortality rate greatly in India, reaching mothers who are most in need of these services in remote and distant rural areas of India. But AIF is not just a one-cause organization. There are a portfolio of causes, all in the fields of education, livelihoods, and public health, and trying to reach the most underserved population of India. We started off as a disaster relief organization, and in keeping with those roots, during this current coronavirus pandemic, AIF quickly pivoted the LAMP program, the Learning and Migration program, which still caters to children of migrants, but quickly provided urgent and immediate assistance to the migrant families as a whole. So we need your help. We need all of you to step up and help AIF help other people. Whether it be a monetary contribution or getting involved with local chapters or coming forward with ideas and thought leadership, that would be most welcome. I hope you will join us in our efforts, and thank you so much for joining today. We really appreciate your presence here. Thank you.